Board of Health for March 8th, 2023. Bobby, would you like to read?
Yes.
Please.
Thank you, Dr. Sturers. Our mission is to promote, protect, and preserve the health and the well-being of the Greater Nashville region through leadership and community collaboration. Our vision is to have an informed, safe, healthy, and resilient community where all people can thrive and prosper. We subscribe to the following values of integrity, leadership, adaptability, and respect.
Thank you very much. Moving forward on the agenda, I'd like to get a motion to approve the February 2023 meeting minutes.
Yes.
So moved.
Thank you. Any discussion, amendments, changes?
No.
Okay. Hi, Stephanie, by the way. Those in favor?
Heather.
Aye.
Aye.
All right, thank you. Moving, going forward, the situation, will update.
Lindsay Bond, epidemiologist for the city of Nashua. So I'll briefly cover COVID-19 statistics along with COVID-19 community levels, our current respiratory illness situation in the hospitals, and lastly, just a quick update on there was a recent measles case that was confirmed through a gathering in Kentucky I'll cover lastly. So for COVID-19, we've had a total of 377,661 cases in New Hampshire, and as of yesterday, there were 66 new cases reported. For patients in the hospital positive for COVID-19, we've had 76 cases, and 30 of those are being treated with antiviral medications. When I looked at last month's update, this is about half of what we saw from last month, so some good news there. We've had a total cumulative death count of 2,995 deaths in New Hampshire. For Nashua, we've had a total of 27,062 cases and a cumulative death count of 187. As of right now, there are 16 people in the hospital positive for COVID-19 at Southern and St. Joe's, and 8 of those are being treated with antiviral medications. Next, for the CDC community level, this is a measurement that uses the number of new COVID-19 admissions per 100,000 in the last 7 days and the percent of staffed inpatient beds occupied by COVID-19 patients on a 7-day average. Based on these metrics, we are in the low for community level in Hillsborough County. Recommendations from the CDC is to stay up to date with COVID-19 vaccinations, including recommended booster doses. This includes the new bivalent booster. Maintain ventilation improvements, avoid contact with people who have suspected or confirmed COVID-19, and then follow the recommendation of what to do if you're exposed. And if you are high risk of getting sick, talk to your healthcare provider about additional prevention strategies. Lastly, you can wear a mask or a respirator at any time, including those in indoors and in public transportation. Next thing I wanted to cover was the CDC RESNet, or Respiratory Virus Hospitalization Surveillance Network. This is a surveillance network that the CDC uses to track hospitalizations from COVID, flu, and RSV within the last several months, so starting in October until the most recent they have is mid-February. If you look at the chart, it looks like COVID is still going pretty strong. We have seen a little bit of a decline since January. And then for flu, we had a peak in late November, early December, and then lastly for RSV, we mostly peaked in November. For this graph, it's mostly reflecting that of the whole U.S. and not just New Hampshire. Any questions so far? Nope. Okay. So lastly, I wanted to cover the confirmed measles case out of a gathering in Kentucky. So the CDC released a health alert network, also known as a HAN. There was 20,000 people that gathered at a university in Kentucky on February 17th and 18th, and out of that gathering, 1 person was confirmed to have measles. This person was not vaccinated. The reason that I'm kind of covering this today, it's just situational awareness that, you know, there were a lot of people at this event, so if people traveled, there is a risk of them bringing it back to places like New Hampshire. It's also a good reminder to stay up to date on your MMR vaccinations, mostly for kids, and also make sure that kids complete their MMR series. Any additional questions? Okay, that's all I have. Thank you.
Lindsay, I have a question.
Go ahead.
I was not able to determine in my reading where the index case may have acquired the measles. My understanding is that that person that had measles ended up bringing it from out of the country. Do we have any information about that?
I don't think so. When I read the Han again this morning, they did not say which country the person had
No, it
traveled
wasn't in the
from.
Han.
Yeah.
Okay. And the other thing is, given the devastating consequences of measles, in addition to the fact that physicians have now received this health alert network to have a heightened awareness that a rash could be measles, is there any education in the community about measles, to ensure that people pursue their vaccinations, but also to get checked early so that any potential transmission could be limited?
Well, I'll answer that just in the sense of pediatricians have been, it went out through the AP News that it's out there, and it's just to be aware of it, especially for new residents who coming out of training, who've never seen it, they've just seen it in a book. So it's just knowledge, but I guess it's just going to fly by the seat of our pants at the moment because we know it's there, but it might be something to think about if it's one of those quandary rashes, we just don't know what it is. So fortunately, we have some antibody tests we can do in order, so there is some way to investigate it, but right now it's out there. It's just not being discussed openly beyond informational purposes like you just provided. Does that make sense? So I don't know what you guys are doing. Is there any flyers or anything, or for the schools, or?
We haven't put anything out as of yet because this was in Kentucky. Hasn't really impacted us here in New Hampshire. We would continue with the messaging for completion of vaccine series and just making sure that kids stay up to date on all of their vaccines.
And our vaccination rates are really high
Right.
in New Hampshire
Right, exactly.
for those vaccines, so we're in the 90s range, so,
Yeah, it's usually 95 and above, if not higher,
Yeah.
so we're very good.
yes.
Stephanie?
Thank you.
Okay.
Thank you.
You're good? Thank you. Moving on, the director's report.
Thank you, Dr. Sturris. Bobby Badley, Director for the Division of Public Health and Community Services. Just a quick overview. Our operational update, we continue to support the staff and collaborate with our community partners to address our core functions of public health and make sure that we are meeting the scope of services for all of the grants that we receive. And the department heads will give their updates on specifics for each of their departments. As far as, in general, our financial update, right now, we have received our 24 budget guidelines, and each of the department heads are working on their prospective budgets. That is due back to our financial services department on Wednesday, and we're making good progress with that already. We are requested to stay within a 3%, I guess you want to call it, level, and so we'll see how that does come out. We also had the opportunity to submit a request to Hillsborough County for some ARPA funds. We submitted this request in the amount of $688,600, and we're looking to support some housing stability through a proposed landlord incentive program and working with our welfare director, Bob Mack, National Soup Kitchen and the Front Door Agency. We're hoping that if this is funded, we'll be able to help support individuals that may already have housing vouchers actually get into apartments, because we've seen some barriers with that. We know that this landlord incentive program has been successful in other parts of the state. Portsmouth has a program, Manchester has a program. We don't have one here in Nashua, and so we're hoping that they will see that that is a need and will support that funding request. We're also looking to extend low-barrier shelter support over the course of the next several months as well. We do anticipate with the ending of the ERAP funds that there may be individuals that will need additional support through this program to secure housing, and our welfare officer, Bob Mack, will speak more to that. I did include in here a legislative update. We get information from either the New Hampshire Public Health Association or from another organization that supports information out for us. And so I did include a couple of House and Senate bills that are coming up. One focuses on the legalization and regulation of cannabis, and that's House Bill 639. The Governor's Commission of Alcohol and Other Drugs is also being presented. This one in particular is important because our agencies actually get funding, in the state of New Hampshire and in, our local area to do work that supports the abatement or prevention of substance use disorder. And so we need for this commission to stay in place to further advocate for funding for those organizations. If that funding is not there, there will be a critical gap in services that will need to be in place. Senate Bill 237 is the Child Care of New Hampshire Working Families Act. This is another bill that's really important. It actually allows for there to be additional funding for our kids to have scholarship programs for child care and also increased child care giver support. And we know that that is an issue in our state as well. And then Senate Bill 36 is relative to our systems of care for our healthy aging population. We have also seen over the past few months that this is important to increase services for home and community services for our elderly individuals. And this will also expand the role of the Office of the Long-Term Care Ombudsman for that as well. Just some highlights from community services. Each report is included in your packet. But just some high-level reports from our team. So behavioral health, they were able to facilitate our substance use disorder, substance use disorder monthly meetings with good participation from our community partners. They've provided various trainings in the community, have also gone to the motels and hotels to provide some trainings for some of the workers there that actually asked. Our community health workers went out and did an assessment, and some of the responses came back that they wanted training on Narcan and our language training, which they have been doing. And then our behavioral health specialists started the New England, and of course there's an acronym, PTTC, Prevention Mentoring Program as a mentor. I have no idea what the PTTC is, but I can follow up with that. Our epidemiologist gave out our situational update and has also played an instrumental role in leading our community health assessment activities, has participated in our diversity and cultural competency workshop that was facilitated by our staff, and has been working with our community partners to address collecting information from them from a survey that has been extended. Our health disparities community health workers have been in the community, again, connecting with our partners, did the assessment at the hotels and motels, and we'll continue that outreach to identify what some of the needs are for that population group, and then continue to be the liaison between our community and some of our service organizations. Our FEP coordinator provided a training to our staff and also at Riviere on what to do when there are extreme temperatures during outreach activities. Also led a tabletop exercise that we all participated in for our incident response team, and continues to maintain our MAZE, which is our multi-agency entity in a steady state of activation level. So we're not an active level, but we make sure that we keep it open just in case something comes up. And lastly, our public health network strategist is planning for our biannual Public Health Advisory Council meeting, which you all have seen, at least have received an invitation. We're hoping if you can make it, that you do attend. It's going to be on April 6th, and we're going to focus on the healing arts of public health, the intersectionality of arts and public health together. Staffing updates. There's some information in here on some of the work that we've done to develop our skill set, and we were very pleasantly surprised and pleased with our community health department that led our February division-wide staff meeting that gave each of our departments the opportunity to learn about specifically what's done in each department and to have some fun. We played a Department of Public Health and Community Services bingo and gave everybody a chance to learn a little something new about each other. We actually have someone that's sitting at this table that wanted to be a tattoo artist. Can you guess who that was?
I do have a little one right here.
Yes. We have, what we were able to learn through that activity, which was a lot of fun, was that we have a lot of very talented staff that sing, they play instruments, they follow the Grateful Dead, one sitting at this table, and they've had experience at quite a few notable accomplishments. So just so that you're aware that you've got some very talented folks over there. We don't just do contact and disease investigation and tracing.
Thank God.
We also, a couple trainings that are coming up. We have a training that's scheduled for an instrument that will allow for us to do some data tracking. It's the VMSG. That will be proposed, that training will take place with our strategic leadership team. We'll each have a license. We will also have a social interaction training provided to the community services staff, some of our community services staff, that is an innovative way of collecting information and engaging our community. And then the rest is just a few bullets on some of the boards and committees and meetings that I've attended during the month of February, and these are regularly scheduled meetings. And then the highlight, our environmental health department. I'm still in Heidi's thunder. They participated in an education training video that was produced for a state health officer, so she can tell you a little bit more about that. But we've, again, we have a talented group over there, so now we have other TV stars. And that's my report.
Thank you. Any questions? Yes.
I just did look up PTTC. Stands for Prevention Technology Transfer Center Network,
Okay,
funded by the Substance Abuse and Mental Health Services Administration.
nice. So Lisa Vasquez is a mentor to someone that's in that program.
Nice. Thank you.
You're welcome.
Any other questions? Stephanie?
No,
Okay.
good.
Thank you very much. Let's see. Community health.
Hi.
Hi.
Good afternoon. Kim Bernard, Chief Public Health Nurse, Community Health Department, Division of Public Health and Community Services. So I'm reporting out on February. I just wanted to make one note that I did make a little bit of a typo. I just didn't put under HIV, HCV, and prevention and outreach on that first page. That should be, those numbers should be on the line below where it says van and street outreach contacts. I just put it in the wrong spot. All
Plus your 2
right.
point.
And I can fix it, I'll fix it and resave. All right, so I just have some updates that I wanted to share that I felt were important from the Vaxwell meeting, which was last Friday. I'm not sure, Dr. Capetta, do you attend that at all? No?
No.
Okay. So on 2/28, the Administration for Strategic Preparedness, the CDC, and CMS met to discuss the commercialization of COVID-19 vaccine. The end of the public health emergency on 5/11/23 is said not to equate with the end of the current national vaccine distribution program or the transition to commercialization. The vaccine will remain at no cost until the United States government supply runs out. Not sure on the timeline with that, but I do know there's a lot of supply circulating. The goal, I'm speaking after going to this meeting, the goal is to continue to supply to the most vulnerable populations at no cost. So some examples of this is that COVID vaccine was added to the Vaccine for Children's contract, so it will remain at no cost. Medicare Part D, it's now required as of January 1st to be covered at no cost. And also as of January 1st of this year, Medicare Part D is required to cover all ACIP recommended vaccines at no cost. So that includes COVID-19. Other state and federal cost-sharing programs will align with the end of the coverage period. The commercialization will align with fall 2023 with the new COVID vaccine campaign, and it will possibly include updated formulations with coverage for new or emerging strains. Some other news surrounding COVID-19 vaccine within the state is that the state mobile services will remain in place until the end of May. The wastewater surveillance dashboard is now live on the DHHS website that was initially started by UNH and has been taken over by the Public Health Lab. And we have reached out to DHHS regarding adding Nashua to that wastewater surveillance. Home tests, and I know this was brought up at the last meeting about home tests. The state has over 100,000 home tests available, and we, at no cost to the public, and we have been stocking them at the division, as I stated last month, and people can just call us for pickup information if folks want them that are in our region. Some MPOX updates from the Vaxwell meeting. Cases continue to decrease nationwide. In New Hampshire, the total case count thus far is 35, and there's been 994 doses given in New Hampshire. The plan surrounding MPOX is to transition to routine vaccination. New Hampshire guidance hasn't changed since the HAN surrounding MPOX. It was HAN number 4. And this includes, what is written in the HAN is that it includes, vaccinating those at the highest risk. And the state is encouraging more providers to carry the vaccine because it is in the nationwide stockpile, so there is a process if we do need it. So they're trying to onboard more providers. So get the word out there. Also, I just wanted to touch upon some legislation, just for awareness. I was able to testify in support of Senate Bill 115 at the State House Finance Committee on 214 with Bobby and Tricia Glassiter, our immunization coordinator. Basically, this is a bill that was set forth to allot funds for vaccine, for us to purchase vaccine at Public Health that isn't covered under the 317 guidelines, because we do have some restrictions and some frustration surrounding that we have voiced to the state. And these funds would allow us to purchase that vaccine so that we could vaccinate those folks. And it is our target population, those that are underserved. So we're waiting for that to hopefully pass. Few more bills. House Bill 557 and House Bill 575 are going to Executive Committee today. I did just check, and they're at recess until a little after 1, so hopefully this afternoon we'll have an answer on these. And 557 has to do with DHS rulemaking authority, particularly surrounding emergencies and like what we just saw with COVID. And 557 would prohibit the state and its political subdivisions from purchasing and promoting, marketing pharmaceuticals or vaccines with certain stipulations. So both of those bills we do oppose. So we'll be watching those closely to see what happens today. Another bill is House Bill 539. That is going to Executive Committee on the 13th, and that is surrounding vaccine clinics at schools. The bill states that they want, within the bill, it wants to restrict school-based clinics during school hours and after school hours. It would have to be at least 2 hours after school is out, and also requiring parents to be present for vaccine administration. They wouldn't accept consent. So we're watching that one. And one that was brought up in the Vaxwell meeting was Senate Bill 35. This is an amendment to RSA 318, which allows pharmacists, pharmacy interns, and advanced pharmacy techs to administer vaccine. So this is adding RSV vaccine. And RSV vaccine is just starting to be trialed, but they're trying to be proactive and getting this bill passed to include that vaccine so that once it does come out, our populations over 65 can go to the pharmacy and get vaccinated. It just decreases barriers. So we are supporting that bill. Some staffing and student updates. We continue to coordinate student experiences from various universities. We continue to have one open full-time RN position, which we did have a candidate interview for last week. And we also interviewed a per diem nurse as well today. Staff development-wise, I have completed Q3 one-to-one meetings with all my staff. And we are scheduling staff to attend various conferences this spring. And I have participated in a few different boards, committees, and meetings. I participated in the incident response team MACE activation that Bobby had referred to. I'm on the Public Health Week Planning Committee. I have participated in the Diversity, Equity, and Inclusion Strategic Meeting with leadership and our equity officer, and coordinated and presented at the division-wide staff meeting on department roles and responsibilities, as Bobby had mentioned. And I also attended 2 sessions of the Dartmouth ECHO Extension for Community Healthcare Outcomes surrounding health policy and Medicare. And lastly, attended Nashua Pal Police Athletic League February board meeting. And that's all I have. Be happy to answer any questions that you have.
Thank you, Kim.
Thank you.
Question?
Oh, any update on the lead? I was asked by Gail Gettins a couple weeks ago to go to Concord for testifying about the lead stuff. Something was coming up.
Oh, the lead bill?
Lead bill.
I don't have any updates on that. But let me get back to you, because I'm not sure that I've heard anything more on it.
Thank you.
You're welcome.
Stephanie?
Yes, I have a question about this 100,000 COVID tests that we have in reserve. So they have an outdate, and notwithstanding that some agencies have said that the outdate may be extended, who knows about these? And are there populations that might not be able to afford getting the testing that a memo or distribution might be accomplished? Because I have this vision of these all sitting there and expiring.
Well, I can speak for what we do. So we do message this out during our outreaches. We bring supply with us. We pass them out. We have, communicated with our partners, to let folks know that they can come to the health department and pick up the tests. We have them right out in our waiting area for folks that come in to our clinics. They have been extended. The expiration date on them has been extended, but I'm not sure as far as what the plan is for the state pushing them out.
I just meant in terms of the Interfaith Council or, social agencies that might be aware of people that become ill and aren't testing and then could potentially infect others. That, to make sure that they all have an awareness that this stockpile, per se, is available.
Sure. So we do have a newsletter that goes out several times a month. I think, is it weekly or bi-weekly?
Yeah, weekly.
Weekly. So it is information that's been included, but we can, maybe highlight that in our next newsletter. We have a lot of partners on that. I don't know how many, but we have a lot of different partners within the community.
No, that would be great. Notwithstanding that, hopefully, as the weather improves, the risks of all of these respiratory and communicable diseases will diminish. We do have several holidays coming up, the Easter holiday and so forth, where a lot of people might be together and might be inclined to test before they put themselves into group situations if they knew that there was an availability, especially since the free tests that have been distributed to seniors through the Medicare program and through many other insurance agencies is ended. So people no longer have access to those 8 free tests a month.
Heidi might have something to add.
I have just a little bit to add. I know that Linda in our office restocks welfares and environmental health's test kits on a regular basis because we're right there on the first floor. And I've seen a lot of people come in and grab a few and
Great.
take them. But we also, if we're working with a specific agency, I know I just dropped a bag off to Mary's house because they've tried to obtain testing for their clients in the past. So if it's something that we're already interfacing with an agency, I know that we're very mindful of getting those out as many as we can before they do actually expire.
Okay, thank you.
Thanks so much.
Stephanie, follow-up?
Thank you. Nope, thanks. My questions were answered. I appreciate
Thank
it.
you. Chuck, you good?
No, and I sent, thanks to Kim, your efforts, I sent it to the pediatricians from Lebanon to Keene to Nashua to everywhere in between, so to call the office. I don't know if anyone
Thank
ever
you.
called you.
Thank you
or
for
if they
doing
passed
that.
the word on, but I gave them the contacts you gave me before.
Mhm. Thank you.
Thank you.
Any other questions? Seeing none, thank you, Kim. Appreciate it. Heidi?
Heidi P. Kokoka, Nashua's health officer, reporting on environmental health activities for the month of February. And actually, our little movie moment was in March, so I will cover that in greater detail, but just for a snapshot and a synopsis, this is through New Hampshire Health Officers Association, DHHS, in an attempt to train health officers in doing the Department of Education inspections for all of the schools. And so we had 2 staff members and another overseeing who participated, and so I'll bring more nuggets on that. So it wasn't actually me who attended. Someone had asked for my autograph.
You have an agent already?
No, that's okay. I'll be way back in the background, and that is perfectly fine. Start off with food service. A lot of what the activity that you see is the stuff that we talked about during last month's meeting, where we had the frozen pipes and then just the waterworks and some different facilities. And so one of those was a license suspension because there were other conditions within the facility, and the other license suspension on this list is due to a facility that had not paid their license for some time, and we finally got their attention, and I think they paid last night. And then one of the facilities that we dealt with during that period of time, they opted for a voluntary closure instead of a placard. So just wanted to kind of give you an idea of what those activities are, and we were, like I said last time, we were very busy during that, but it was very gratifying to be able to work and actually make a difference in the community and make some recommendations, and it's a little out of what we do on a regular basis, so staff were actually pretty positive about the experience. We are seeing rodents in food service, but we also get complaints about them in the public as well. It just seems to be a really bad year for rodents. And further into the report, Ren mentions a virtual rat academy that he attended, and I had been in touch with City of New York, New York City, to see if we could participate in those. And so he's attended. We all will attend. We're looking for someone to come and keep us more up to date with what kind of recommendations we can make within food service or any other setting as well, and what the current recommendations are from licensed pest applicators, and we're looking for local talent that we could use so that we could get the word out a little bit better for our license holders and members of the public as well. But they are seriously here this year. But it's probably just one of those things that cycles in nature. Our failure rate wasn't that bad, but we still see food service is impacted when it comes to staffing and cost of food and trying to make repairs on equipment and getting those parts. Let's see. Not seeing anything that really jumps out at me. We're still seeing some bites from dogs and cats that are being tested for rabies, and we had a good discussion in our internal IRT that it looks like some of the state guidance is changing a little bit as far as testing for rabies of vaccinated pets, where they haven't always done that in the past. But so it's a little shift, and we work very closely with community health nurses to try and figure out what the best standards are, but we're trying to stay ahead of this and figure out what guidance you need to make in that critical moment about testing animals. But certainly, good pet ownership is appreciated, and we also discussed the trend of untrained animals in public, and we're concerned about warmer weather and what that's going to mean, where pets will come into closer contact with humans. Still, we show our revenues here. We're doing quite well with our revenues, and staff are busy with a lot of different trainings through FDA and AFDO and all of those other letters. And we also attended the tabletop exercise, and we're very appreciative that it was a realistic scenario and that we could immediately wrap our heads around a foodborne outbreak and what we would do. But it gives us a really good opportunity for the interdepartment communications and work together. And so we're also kind of looking for some specific training to try and get those critical people up to speed with the forms. And I think that Flavia had sent out a really good model of a questionnaire for people affected with foodborne illness, suspected foodborne illness. So that was time that was very well done. And so the rest are just some other meetings that we attend. Both Renan and I are involved in New Hampshire Health Officers Association. We get a lot of our legislation information through that organization, through New Hampshire Municipal Association. Our board of directors opted to have New Hampshire Municipal Association provide an update for a fee for us. And it's been very beneficial thus far. And let's see, I think that's really about it, other than continued meetings to deal with the issue of encampments, and we've seen some fragile people in home settings that needed some intervention. And so far, thanks to Lindsay, we're tracking some of that a little bit better so that we can see if there are some common themes and what we do with it. And it's good information to have, and there are a lot of people who don't have a voice in the community, and so we're trying to get in there and when we find out about something to help a little bit more proactively.
Thank you, Heidi. Are there any questions? Seeing none? Roberto, you're up.
Good afternoon. Bob Mack, Welfare Officer for the City of Nashua. Just reporting on the Welfare Department for the month of February. You can see in the report the significant difference between shelter costs from last year to this year. It has been kind of a challenge comparing last year numbers to this year numbers because of the shifts in different resources such as the emergency rental assistance and the eviction moratorium and things like that. had a significant impact on what we needed to do last year versus this year. So as some of those programs are winding down, you can see that increased need for rental and shelter requests. So an increase in those numbers of shelter vouchers issued for the month compared to last year. And if you look at our overall expenditures, this year we've spent about $278,000 of the FY23 budget, which is about 67%. Last year, our total expenditures were around $270,000. So, and that was about 50%, 57% of last year's budget. So we're definitely going to be spending more money this year, and we'll continue to monitor that. We continue to work with our community partners to make referrals to different resources. Let's see. Last year, a lot of the households were receiving the ERAP assistance. We're working, the emergency rental assistance, we're working closely right now with Southern New Hampshire Services and their case management staff to try to ensure that people receiving the assistance in the motels that will end in a few weeks will be able to get connected to resources in the community if they're unable to pay for their own stays in the motels. We have had communication with the local shelter programs who should have some space. As Director Bagley mentioned, we're looking to bring some funding into the community to continue some of the overflow sheltering, which has been very beneficial for the winter months. But that initial funding source, that county funding source, is going to be exhausted in the next few weeks, 4 to 6 weeks, I believe. So we'll continue to communicate with our shelter partners. Staff did participate in various community meetings throughout the month. One of the meetings, or the councils that I participate on, is the Governor's Housing Stability Council. The landlord incentive program that Director Bagley was talking about is also on the radar of that state committee. So they also see the need for that. There have been some pilots and some programs established throughout the state. I think there's a handful of them active now. So we can look at some of those as models, but it's pretty clear that we need to do something to get these tenants with these vouchers in hand to be able to rent apartment units. So this is also an issue that has been discussed at our own City Housing Trust Fund Council, which is a newly formed council through the city as well. So we're hopeful that some additional monies will come for that, and again, as Director Bagley mentioned, the partnership with the Front Door Agency and the National Soup Kitchen is something that's highlighted in those requests. Let's see. Just another thing to note, the Housing Authority wait list for Monahan Manor opened up at the end of this past February. In speaking with Susan Mead from Greater Nashua Mental Health, she was in line to apply for one of her tenants and said the line was out the door and around the corner. So a lot of people were signing up to get on that wait list for that particular housing program. There was an increase in the number of subsidized housing units that should be available through that program, and it's going to be a mixed use, mixed income rental market program. There are a number of other housing programs that are being developed throughout the city that will help in the long run, but we still have to focus on what the immediate needs are for a lot of these folks. So something like the landlord incentive program would definitely help with that. I sound kind of like a broken record because I've been talking about that a lot lately. But one of the other issues that came up at the Governor's Housing Stability Council and the state level is the need for respite beds. As Director Bagley mentioned, we're working closely with the hospitals to try to identify those patients that no longer need hospital care but don't have any place to go, and And so some of these folks have been in the hospital for 200-plus days because they don't have any place to go. And they didn't need to be there that long. So out of one of our subcommittees, the Healthcare Coordination Subcommittee through the Greater Nashua Continuum of Care, that was a topic of discussion, and Director Bagley brought that up to the state level, which I think helped to put this on the radar. So that's hopefully something that they will find some funding for. I think they're targeting at least 3 of these types of respite centers, if you will. Not exactly sure what that's going to look like, but at least it's on the radar and it's being talked about and explored. So let's see what else we have here. One last thing I wanted to mention, some of you may remember Terry Charest, who was a longtime employee of City Welfare. She kind of trained me when I started there. She recently passed away. She retired from the city about 7 years ago. But our thoughts and prayers are with her and her family. So I just wanted to bring that to your attention because I know some of you knew Terry. So, and that's
Bob's memorial service, the date.
Oh, the service is, there's wake on Friday at 4 at Ankle Rochette. I believe it's from 4 to 8, and a service on Saturday at 10 a.m. at St. Louis Church.
Our condolences, family, friends, trainees. So, any questions? Stephanie?
No, thank you.
Sorry.
Very good report.
Didn't know if you were still there.
here.
Seeing nothing else, just open up for public comments if any of the public has any. I don't see any hands. Looking for a motion to adjourn.
So moved.
We are adjourned. Thank you very much for your patience, your time.
Thank you, everyone.
And your expertise. Stephanie?